Breaking medical news tonight. A new study is shaking up the treatment options for severe hip osteoarthritis, with researchers finding that total hip replacement is significantly more effective than resistance training in reducing hip pain and improving function in patients over 50. Ladies and gentlemen, I would like to bring to your attention the research endeavors of Thomas Frydendahl, a researcher with a profound focus on orthopedic surgery and rehabilitation. As we delve into his work, it becomes evident that his expertise spans a wide range of topics, including the biomechanics of joint replacement and the complexities of hip disability. Notably, Frydendahl's research has centered on the efficacy of total hip arthroplasty as a treatment option for patients suffering from severe hip osteoarthritis. His work has shed light on the nuances of this procedure, highlighting the importance of careful patient selection and the need for a multidisciplinary approach to care. Furthermore, Frydendahl's research has also explored the impact of hip disability on patients' quality of life, emphasizing the need for comprehensive rehabilitation programs that address not only the physical but also the psychological and social aspects of hip disease. His work in this area has significant implications for the development of more effective treatment strategies and improved patient outcomes. Frydendahl's research interests and expertise are a testament to the growing importance of interdisciplinary collaboration in the field of orthopedic surgery. His work serves as a reminder that the most effective solutions to complex medical problems often require a nuanced understanding of the interplay between biomechanics, physiology, and patient-centered care. As we continue to push the boundaries of medical knowledge, it is essential that we draw upon the expertise of researchers like Thomas Frydendahl, who are dedicated to advancing our understanding of the human body and improving the lives of patients worldwide. The Oxford Hip Score, a widely used outcome measure in orthopedic surgery, has been a cornerstone in the assessment of hip function and disability in patients undergoing total hip replacement. Developed to evaluate the effectiveness of this procedure, the Oxford Hip Score has undergone rigorous validation and has been shown to be a reliable and sensitive tool for measuring patient-reported outcomes. The Oxford Hip Score consists of 12 items, each addressing a specific aspect of hip function, including pain, stiffness, and mobility. Patients are asked to rate their symptoms and functional abilities on a 5-point scale, ranging from no pain to severe pain or unable to perform the activity. The scores are then summed to provide a total score, which can range from 0 to 48. This comprehensive assessment tool has been instrumental in evaluating the efficacy of total hip replacement in patients with severe hip osteoarthritis. By capturing the nuances of patient-reported outcomes, the Oxford Hip Score provides a more accurate representation of the impact of hip disease on patients' quality of life. Furthermore, it has been shown to be a valuable tool in identifying patients who are likely to benefit from total hip replacement, as well as those who may require additional interventions or rehabilitation. The Oxford Hip Score has also been used to evaluate the effectiveness of various surgical techniques and rehabilitation protocols, providing valuable insights into the optimal management of hip disease. Its widespread use has contributed significantly to the advancement of orthopedic surgery, enabling clinicians to make informed decisions about patient care and treatment. As we continue to refine our understanding of hip disease and its treatment, the Oxford Hip Score remains an essential tool in the assessment and management of patients undergoing total hip replacement. The management of severe hip osteoarthritis presents a complex challenge for clinicians, with treatment options ranging from conservative measures to surgical interventions. Two approaches that have garnered significant attention in recent years are progressive resistance training and total hip arthroplasty. While both have shown promise in improving patient outcomes, a recent study by Thomas Frydendahl sheds light on the relative benefits of these two approaches. Frydendahl's study compared the efficacy of progressive resistance training with total hip arthroplasty in patients with severe hip osteoarthritis, highlighting the importance of careful patient selection and the need for a multidisciplinary approach to care. The results of this study suggest that while progressive resistance training can provide significant improvements in hip function and pain reduction, total hip arthroplasty offers more substantial benefits in terms of functional improvement and quality of life. Notably, the study found that patients who underwent total hip arthroplasty experienced a greater increase in the Oxford Hip Score, a widely used outcome measure in orthopedic surgery, compared to those who received progressive resistance training. This suggests that total hip arthroplasty may be a more effective treatment option for patients with severe hip osteoarthritis, particularly those with significant functional impairment. However, it is essential to consider the potential drawbacks of total hip arthroplasty, including the risks associated with surgery and the need for ongoing rehabilitation. In contrast, progressive resistance training offers a non-invasive and cost-effective alternative which can be tailored to individual patient needs and preferences. Ultimately, the choice between progressive resistance training and total hip arthroplasty depends on a careful consideration of the patient's clinical presentation, functional status, and personal preferences. As clinicians, we must weigh the potential benefits and risks of each approach and work collaboratively with our patients to develop a treatment plan that addresses their unique needs and goals. The management of hip osteoarthritis requires a comprehensive approach, incorporating a range of treatment options to address the complex needs of patients. While surgery is often considered a last resort, it is a critical component of the treatment algorithm for many patients. In addition to surgery, non-surgical treatments play a vital role in managing hip osteoarthritis. Lifestyle modifications, such as weight loss and exercise, can significantly reduce symptoms and slow disease progression. Physical therapy, including exercises and modalities, can improve joint mobility and reduce pain. Medications, including analgesics, anti-inflammatory agents, and disease-modifying osteoarthritis drugs, can provide symptom relief and slow disease progression. However, for patients with advanced disease, these non-surgical treatments may not be sufficient to alleviate symptoms and improve function. This is where total hip arthroplasty comes into play. As a surgical intervention, total hip arthroplasty offers a durable and effective solution for patients with severe hip osteoarthritis. The role of total hip arthroplasty in the treatment of hip osteoarthritis cannot be overstated. By replacing the damaged joint with a prosthetic implant, total hip arthroplasty can restore function, reduce pain, and improve quality of life. This procedure is particularly effective for patients with advanced disease who have failed non-surgical treatments or who have significant functional impairment. In recent years, advances in surgical techniques and implant design have made total hip arthroplasty a more accessible and effective treatment option. The development of minimally invasive surgical techniques, such as anterior approach hip replacement, has reduced recovery time and improved outcomes. Additionally, the use of computer-assisted navigation and robotic-assisted surgery has improved accuracy and reduced complications. As we continue to refine our understanding of hip osteoarthritis and its treatment, it is essential to recognize the critical role of total hip arthroplasty in the management of this complex condition. By combining advances in surgical techniques with a comprehensive approach to patient care, we can provide patients with the best possible outcomes and improve their quality of life. As we continue to advance our understanding of hip osteoarthritis, it is essential that we prioritize research efforts to address the most pressing questions in this field. The work of Thomas Frydendahl and the Lillebælt Hospital, University Hospital of Southern Denmark, serves as a prime example of the importance of setting research priorities and promoting robust research designs. Frydendahl's research has highlighted the need for a more nuanced understanding of the complex interplay between biomechanical, physiological, and psychological factors that contribute to hip osteoarthritis. His work has also emphasized the importance of developing more effective treatment strategies that address the unique needs of individual patients. To achieve these goals, it is essential that we prioritize research efforts that focus on the development of more robust research designs. This includes the use of randomized controlled trials, longitudinal studies, and other methodologies that can provide high-quality evidence to inform clinical practice. Furthermore, it is crucial that we promote collaboration and knowledge sharing between researchers, clinicians, and industry partners to accelerate the translation of research findings into clinical practice. This can be achieved through the establishment of research networks, the development of shared research infrastructure, and the promotion of open science practices. By prioritizing research priorities and promoting robust research designs, we can ensure that our research efforts are focused on addressing the most pressing questions in the field of hip osteoarthritis. This, in turn, will enable us to develop more effective treatment strategies, improve patient outcomes, and advance our understanding of this complex condition. Ultimately, the success of our research efforts will depend on our ability to work together, share knowledge, and prioritize research priorities that align with the needs of patients and clinicians. By doing so, we can make a meaningful impact on the lives of individuals affected by hip osteoarthritis and advance the field of orthopedic research as a whole. In conclusion, this presentation has highlighted the latest research and findings in the field of hip osteoarthritis, with a focus on the work of Thomas Frydendahl and the Lillebælt Hospital, University Hospital of Southern Denmark. Key takeaways from this presentation include: total hip replacement is a superior treatment option for patients with severe hip osteoarthritis compared to progressive resistance training. The Oxford Hip Score is a widely used outcome measure in orthopedic surgery, which assesses disability in patients undergoing total hip replacement. Total hip arthroplasty is a critical component of the treatment algorithm for hip osteoarthritis, offering a durable and effective solution for patients with severe disease. Setting research priorities and promoting robust research designs are essential for advancing our understanding of hip osteoarthritis and developing more effective treatment strategies. This content is the product of Aura, produced with Intellect Cascade, a research product of Big Blue Ceiling.